Within roughly 10 years, there's going to be a point at which we're not able to pay beneficiaries their full amount. What's the cut to their benefit that they will take?
17%.
17% automatic cut if we do nothing.
Elders are working to higher ages now, which is a very, very positive effect.
The idea that the normal retirement age is 70 is crazy.
I say to you, make my day.
It's our unfunded liability now on that, on Social Security.
Well, we actually, per the Federal Accounting Standards Advisory Board, we don't really talk about it as an unfunded liability, but an unfunded obligation in the future. What's Social Security at this moment is, in fact, its expenditures are exceeding the amount of revenue coming in.
When Social Security was first began, how many payees or payors paying into it versus the recipients? What was that number like? 40 to 1, something like that?
41, but of course.
40 to 1?
When insolvency does hit us, the federal government will have to pay back this $2.6 borrowed money it owes to the Social Security Administration.
I also want to welcome our witnesses. Mr. Paul Spitalnic serves as Chief Actuary for the Centers for Medicare and Medicaid Services, and Mr. Stephen Goss. Thank you all for being here. He serves as Chief Actuary at the Social Security Administration. That's a pretty challenging set of forces on the solvency of the program. 10,000 a day coming onto the program and the basis of revenue stream to support it. And it was set up to be self-sustaining, but that's not a self-sustaining set of trends. That math won't work, and it won't work even according to the trustees and your report. It will become insolvent by when? 2033? Where we aren't bringing enough revenues in to pay the full benefit to every 60+ million beneficiary who has earned this benefit from this program.
2033 is exactly right for the separate OASI fund. On a combined basis, it's 2035.
So on the current path, with the current trends, by 2033, what will be the cut in what did I say,
2035.
2035?
So 2035 for the OASI and DI funds on a combined basis.
Okay. Within roughly 10 years, there's going to be a point at which we're not able to pay beneficiaries their full amount. How much will they take in a automatic cut if we as Congress don't do something, whether it's a programmatic reform to make it more sustainable or a pay for to make it sustainable? What's that cut look like?
We are confident you all will make these changes, but if, as you're suggesting, we did not have such changes, we'd be in a position in 2035 of being able to pay only 83% or a 17% reduction in total expenditures that could be made compared to what's intended for the full scheduled benefits. That does not necessarily mean an
What's the cut that seniors will take? What's the cut to their benefit that they will take?
17%
Automatic
on average,
cut.
on average.
Automatic cut. Seniors need to hear that. 17% automatic cut if we do nothing, correct? Okay, and you have more confidence in Congress than most of our constituents.
Speak about that and draw the link between the two and why it is that now we do have until 2035 and 2036 respectively instead of a date that is closer.
I think over that time period, the improvement we've had is largely because of the economy. There's been improvements in productivity and the labor force that has brought in more revenue and it has resulted in an increase in cost. And also employment rates have been very strong. And one of the things that's been really good is, as mentioned already, with the retirement of the baby boom generation upon us, elders are working to higher ages now, which is a very, very positive effect.
Can you explain reasons why expenditures are going up quicker than income? Then I'm going to give you a question I don't know that you're qualified to answer.
Sure. There's several reasons why expenditures out of the HI Trust Fund are growing faster than the income. My colleague, Mr. Goss, mentioned a most significant one, and that's the changing demographics. That as the baby boom generation in particular has been retiring, they are moving from the employed paying into the program into beneficiaries receiving benefits from the program. And so that demographic shift is the largest component of why that shift is occurring.
That makes sense, but how much are we spending, say, per 70-year-old, per 72-year-old, whatever? how is the healthcare spending per person going up relative to inflation?
On a per capita basis, spending in the Medicare program has actually been tracking pretty closely to the general inflation rates. So there's been pretty consistent increases in the recent past. In the trustees' report, there is projected that those per capita costs will increase at a faster rate in the near future and into the future, mostly because healthcare costs tend to increase faster than other sectors of the economy.
That's exactly what we're trying to get at. Where's the cutoff there? 19,000, 20,000? Where do we begin to say you get less money the more you work?
Excellent question. I think it's in the order of between 15 and 20,000. I don't have that exactly at my fingertips. But an important part of that is the reduction from the retirement earnings test only applies for people up to age 67. At 67 and above, where people can receive benefits without any effect. And
Are you sure it's 67? Is could it be higher than that?
currently it's 67. It's at the so-called normal or full retirement age where the retirement earnings test stops applying. But the good news is that if anybody receives a reduction in their benefit, if they start receiving benefits before 67, and then they receive a reduced monthly benefit at any point before 67, we will recompute your benefit as of 67 and for thereafter, and take away the reduction for having received benefits
You'll get
in
more
earlier
forever.
months.
Okay, and I would just go on record as saying the idea that the normal retirement age is 70 is crazy.
When you talk about cutting Social Security and Medicare in any way that is reducing the benefits, I say to you, make my day. These are, as our ranking member said, the most popular programs in the country. The vast majority of Americans rely on them. And the very idea that the only way that we can solve our economic problems is to cut these programs, make my day. And let me just say this. There are 67 million Americans right now who rely on Social Security. And let's once again say that this is not an entitlement program. These are people who have paid every paycheck to have this earned benefit, and the idea that it would be cut.
Were you suggesting earlier that we have true cash reserves in the Social Security Trust Fund versus an IOU, and that those funds aren't being effectively used to cover other deficit spending?
We certainly do. We have $2.8 trillion of excess taxes that were paid in by American workers and beneficiaries, and were invested in the trust funds.
What's our unfunded liability now on that, on Social Security?
Well, we actually, per the Federal Accounting Standards Advisory Board, we don't really talk about it as an unfunded liability, but an unfunded obligation in the future. A little semantic difference there. But that is, I don't have the number exactly, but it is many, many trillions of dollars. All that represents is the shortfall in the future of the total amount of scheduled benefits under law versus what we have scheduled for revenue. And we know we have to better align those in the future.
Yeah, so wouldn't it be true that Social Security and other mandatory programs are matching, if not exceeding, total tax revenue at this point?
I'm sorry, could you?
Total mandatory programs, including Social Security and Medicare, do they not match or if not exceed total revenue coming in at this point?
Well, at this point, Social Security at this moment is in fact, its expenditures are exceeding the amount of revenue coming in.
fair
And
point.
that's where the trust fund reserves.
Because every discretionary dollar we vote on is borrowed. Every single discretionary dollar is borrowed, right? We recognize that. Would either of you venture an estimate on what's the typical lifetime payment into Social Security versus the lifetime typical benefit, dollar-wise? How much is the typical person has paid into Social Security now versus over the lifetime what the recipient benefit is?
We have a number of actuarial notes up on the web addressing that, and the interesting part of that is It's a question of whether you compare the amount that individuals have and are expected to contribute under current law tax rates versus, then the question is, versus the benefits that are simply scheduled in the future or the benefits that will in fact be payable under current law. If you look at the scheduled taxes for an individual to pay at various different earnings levels compared to the scheduled level of benefits, which, as we know, we're underfinanced for actually paying those, that looks very generous, but it's not possible under current law. And of course, the ratio of what you can expect to receive to what you've paid in does vary because we have a progressive payment system for Social Security, as we're all well familiar. The benefit formula favors those with the lower earners.
The typical person paying into Social Security pays about how much per month for, say, 40 years? And so therefore, at the end of when they retire, they've paid how much in versus how long they typically receive Social Security and how much that monthly benefit is? Surely you have some estimate of how those two numbers compare.
So try to do a little bit of arithmetic real quickly here. If we have a $60,000 a year worker or $5,000 a month and they're paying 6.2% of that themselves.
So $300 a month, $3,600 a year, take that times 20 years, that
Right.
would only be $70,000. All right, that person at retirement is going to receive how much of a monthly benefit on average?
I don't have that number right offhand, but it's,
Well, it's going to be a lot more than if you, let's say an average recipient's 20 years at $1,500 a month, that's $18,000 a year. $18,000 a year times 20 years is $360,000. You just told me they were paying $70,000 in and receiving, with that estimate anyway, $360,000. When Social Security was first began, how many payees or payors paying into it versus the recipients? What was that number like?
well, when Social Security first began, the ratio was something
30 to 1, something like that?
41, but of course.
40 to 1?
Yeah.
What's the payee versus recipient now?
It's not between 2 and 3, and we're heading down towards 2.
2 or 3 to 1, right?
Yeah, but of course, remember at the very beginning, beneficiaries could only get a benefit in 1940 if they'd worked for at least 2 out of the 3 years prior to that. So not many 70 to 80 to 90-year-olds were eligible for a benefit.
For a person making $400,000 a year, this question, by the way, may seem familiar to you from the hearing at the Ways and Means Committee. But for a person making $400,000 a year versus, say, a person making $50,000 a year, can you just spitball what percentage of a person's income in those two cohorts, what percentage of their income goes to Social Security?
Well, the person making $50,000 is easy. It's they pay 12.4%, half by themselves and half by their employer. For a person making, I'm sorry, that was 400,000?
Right, 400,000.
Because payroll taxes are only paid this year up to 168,600, that would leave you in a position of the payment on that amount of their earnings would cover about 5% of their total 400,000, about 5.2% maybe, 2.6% by them and 2.6% by their employer.
Talking through that hypothetical example of a person making $60,000 a year and what they pay in versus what they receive in benefits and how that impacts the Social Security Trust Fund. Can you elaborate on that a little bit? I know you, if you don't have at your fingertips a little bit more than what you answered to Mr. Good, maybe I'd ask you if you could kind of thumbnail sketch that, what over a 35-year career of paying in versus payments out at current life expectancy.
So we do have a couple of items up on the web that we redevelop pretty much annually. The money's worth ratios, which is just what we're talking about, the present value of the contributions you and your employer made relative to the amount of benefits you might expect, or the internal rate of return, what kind of rate of return would be required. Looking at the money's worth ratios, if we look at that compared to what the benefits are scheduled to be in the future, then those are in reasonable alignment. What we currently have, though, is a situation where our scheduled benefits are in excess of what are payable in the future based on the contributions that have been made and will be made in the future, largely because of the changing life expectancy, not life expectancy, but really largely because of the changing age distribution of the population.
Yep.
No, and we can submit much more for the record on that. Thank you.
Yeah, and that may be something that we get some follow-up information or research on that. Because, to some degree, it's kind of a math problem on Social Security, is the amount of money going in has to equal or be greater than the amount of money going out to make through that process. And that there's two factors to that. One, the number of workers versus retirees and what's being paid in, and also the life expectancy, as you mentioned earlier. What was the life expectancy when Social Security was created and 65 was set as the age in which payment, the full retirement payment was made? What was the life expectancy at that point in time?
I'd have to probably go back to the trustees report and pick that number up, but I can share with you this one, I think, interesting detail, which was back in 1983, at the time of our last major amendments, when we were foreseeing what would happen. We were projecting that by about 2015, 2018, before the pandemic, that life expectancy at age 65 would rise to, I believe the number was 16 or 16.1 years. It was much lower than that back in 1983 and earlier. And we were projected it would rise to about 16.1 years. Lo and behold, that turned out to be very accurate. So our projections about life expectancy and decline in mortality rates has been very, very accurate.
Okay, I was thinking life expectancy in 1937 was about 63 years, and that was kind of what I was trying to confirm versus today. Life expectancy, as you mentioned, it's closer to 85, 86, depends on when you calculate it on the actuary tables, which has an impact on the amount of time that you have payments going out.
Very much
based
so.
on-
We try to focus to a great extent on what life expectancy is as of, say, age 65 being important, because much of the improvement in life expectancy from many years back was because of a reduction of early childhood and infant mortality. So a lot of that restriction down to maybe only 60-something was because many people were unfortunately perishing at a very young age, even before they would enter the workforce.
Right, right. Shifting gears just a little bit, so it's correct that in 2033, the old age and retirement trust fund's going to be depleted, right, run down.
The reserves depleted.
And at that point in time, what was the latest expectation of, or estimate of what the shortfall was? Was it, it's in the 22 to 23% range?
A little bit less than that. I think we're at, 79% payable at that point.
When insolvency does hit us, the federal government will have to pay back this 2.6 borrowed money it owes to the Social Security Administration. And politicians are looking to save their careers. I'm concerned are going to print that 2.6 trillion just to make that payment. And inflation will increase, which is going to erode the program. I want to just end with this, because I'm out of time for the rest of this. Mr. Goss, give me in 5 seconds what you think, 2 different things that you think we ought to do to secure up Social Security.
Well, I'm sorry to indicate to you that as the sort of, dare we say, umpires in the ball game, we try not to take any sides onto what ought to be done. But we do know that over the long term for Social Security, we are going to have some combination of, it could be all one or all the other, or some combination of on the order of a 25% reduction in the level of scheduled benefits for the future, or a 33% increase in the revenue for the program. And it's really up to you all as the elected representatives of the American people to decide which way we go on that.
The Assuring Medicare's Promise Act. And what it would do is to extend the solvency of Medicare by requiring that those who are currently avoiding the net investment income tax can no longer do so, and redirecting all of the revenue from that tax into Medicare as was originally intended. We actually did that in the House through the Build Back Better legislation, which unfortunately did not get approved over in the Senate. The President's Medicare proposal goes a step further, and I believe that you have done an analysis of it and presented it to us, indicating that the President's initiative, which does involve some additional taxation, I believe the memo here from the CMS office is that would fund the HI program, it would be sufficiently funded indefinitely. Is that correct?
That is correct. The work that we did in analyzing the budget proposal included in this year's budget suggested that that additional revenue would make the HI trust fund solvent indefinitely.
As you know, delaying action on financial matters often makes those matters worse. Mr. Goss, how would delaying action affect the scale of the changes needed? And if changes are made at the projected date of trust fund solvency, what kinds of changes need to be required?
Our trustees have consistently for many, many years indicated the great advantages of acting sooner, which are, first of all, that there are more options on the table the sooner that you all act. The other is we give more advance warning to individuals who will be affected. And the third is that actually the level of reductions that are necessary at the point of reserve depletion might be somewhat less, but not dramatically less. As indicated on one of the earlier questions, if we were to actually enact and effect changes immediately, that would help us in terms of satisfying the reductions necessary as a whole over the next 75 years. But the key thing, really, I think what the trustees have put forth is to enact as soon as possible so that we will have lots of options to consider.
The Social Security and Medicare Board of Trustees annual report showed that combined old age and survivors insurance trust fund and the disability trust fund will be able to pay 100% of scheduled benefits until 2035, and afterwards 83% of benefits will be met. So question that I have, Mr. Goss, do you believe Social Security will completely run out of funding before younger adults can receive Social Security benefits? I think it's very important for us to address this head on.
I would say, if you say completely run out of funding, I mean, clearly not, because even if we do reach the point where we deplete our now $2.8 trillion of reserves and have that savings account in effect depleted, we will still have coming in on a daily basis the revenues from payroll taxes and income taxes that beneficiaries pay on their benefits. That would continue coming in. But as you indicated, covering at that point of reserve depletion, about 83% of the continuing cost of paying full scheduled benefits. So it would not go to zero. It wouldn't be that there would be running out of money or having no benefits, but a reduction unless you all act to counter this.
Mr. Spitalnic, the Medicare funding warning, quote, this year the trustees issued a Medicare funding warning. Can you explain what that is? And what does that require as a response from the legislature or the president? Is it a trigger of some sort that is intended to require some action? So give us a background on that.
Sure. I think it started back in the Medicare Modernization Act back in 2003, put in this requirement where the trustees would evaluate the proportion of revenues that were dedicated sources, and when that proportion exceeded 45%, this warning would effectively be triggered if certain conditions were met over 2 consecutive years. Effectively, if there was more than 2 consecutive years of general revenue, general government contributions into the Medicare program, when that exceeded this 45%. It was somewhat of an arbitrary.
Yeah, I was going to say, why did we pick those numbers? Arbitrary, as you said. But the idea is what? Why do we do it?
So when this was, in response to a Medicare funding warning, the Congress has asked that the president, in response, in their subsequent budget, would provide proposals that would address that particular circumstance. So they'll get the proportion of funding dedicated down to that 45% level. My understanding is that the executive branch under different party leadership have each concluded that, in their opinion, that provision, that requirement that they actually provide a proposal in response to that trigger is unconstitutional. And I am far from a constitutional lawyer, and so I will not opine on any of that, but as part of the work of the Board of Trustees, they do calculate and determine whether this trigger is reached or not.
I would certainly like to understand that. It didn't seem to me like it would be unconstitutional or require action by the executive branch, by the president, by the administration, when we've cross some threshold, even if it is arbitrary, when we know there's going to be problems going forward. So certainly that would have been the intent of the previous Congresses who put that into law, so I hate to see it ignored.
Are there any other ways that you guys know of that you can reduce the expenses other than those three things that I talked about? Either one of you? That people are talking about?
I think abstractly, you have it exactly right, that the only way to improve the financial condition is to either increase income or to decrease expenditures. There are a number of ways to go about considering decreasing expenditures, and there's a long list.
Could you give me a couple of them, just so I know?
Decrease prices is one way, but
That's what I talked about already. Are you talking about for all kinds of healthcare costs?
well, you don't necessarily have to negotiate drug prices. So much of the Medicare program have their prices updated each and every year, often related to inflation. And so there are certain provisions in the current law that have some of those updates increasing slower than rates of inflation. So that's already baked into existing estimates that some...
Could those be cut more than they are? Could those costs be reduced more?
The funding deficiency, so the current deficit accounts for already those reduced.
Could they be reduced more beyond the existing numbers, the existing projections?
It is certainly theoretically possible to...
And what would happen? You'd make the pharmaceutical companies mad, or what would be the other what's the theoretical thing stopping you from doing that?
Well, you all have the privilege of establishing what the payment rates are.
Oh, it's up to us?
It is up to
Oh, okay, all right.
In fact, I bet if you just randomly selected, this is a sad commentary, but I'll end on a criticism of this institution. I bet if you randomly selected 10 high school students from around the country and you gave them the same set of considerations and reform ideas, I bet they could come out with a consensus solution that would be something that most of Americans would accept as logical and common sense and on balance, good for the public good. With that,